Hi friends, welcome back to my channel, and today we are going to discuss about the mechanisms involved in the formation of a cyst. And before we dig in deeper, first let us run the intro. A cyst is a pathological cavity that either contains fluid, semi-fluid or gaseous content. Now that pathological cavity can be either lined by epithelium, in that case we call them as a true cyst, may not be lined by epithelium, in that case we call them as a pseudocyst. Whether it's a true cyst or a pseudocyst, both of them do arise from a group of cells. If those group of cells were involved in the formation of a tooth, in that case we call them as an odontogenic cyst. If those group of cells were not at all involved in the formation of a tooth, in that case we call them as a non-odontogenic cyst. But however, for this particular topic today, I'm going to discuss the three most important odontogenic cysts, and they are your radicular cyst, dentigerous cyst and odontogenic keratocyst. To begin with, let's start with the radicular cyst. The mechanism involved in the formation of a radicular cyst can be explained in three phases. They are your phase of initiation, basically how it starts, phase of proliferation, also called as phase of cyst formation, and the third one is the phase of cyst enlargement. So basically how it begins, how the cyst forms and how the cyst enlarges. Now let's go one by one in detail. Now let's take up phase of initiation. Say whenever there is pulpal infection or pulpal inflammation, there are bacterial toxins or the bacterial products that are actually spilled into the periapical region, and because of this the periapical region elicits an inflammatory response. The body has inflammatory cells and they automatically elicit an inflammatory response, and this particular response is in the formation of production of certain lymphokines, certain cytokines, and these lymphokines not only act just against the bacteria or the bacterial toxins. Unfortunately, they also act on two things. One, they also resorb the surrounding bone around the periodontal ligament, number one, and also the lymphokines that are actually secreted to counteract the bacterial toxins will also start acting as a stimulant or as a growth factors for the cell rests of Malleus which are normally present within the periodontal ligament. When these cells receive the signals and they act as stimulants, these cells starts to proliferate, and as they proliferate, and that leads to formation of a solid mass, and this is nothing but your phase of initiation. Now let us see how exactly this particular solid mass will get converted into a cyst, and that is explained by your phase of cyst formation. As the solid mass continues to expand, because there is continuous supply of the bacterial toxins, the central cells which are there within the solid mass are devoid of nutrition, or the lack of nutrition occurs because they are placed very much away from the nutrition which are usually present at the periphery, and because of this lack of nutrition or deficient nutrition, the central cells will start disintegrating, the central cells will start dying, and because of this the whole necrotic process will set in, and because of that there is a central lumen within the central mass, and that is explained by your phase of cyst formation. So basically now we have a central lumen which contains dead and degenerating tissues that has actually undergone necrosis, so there might be some kind of fluid going by the definition of a cyst, and this particular central lumen is actually covered by your living cells or a mass of cells which are nothing but your cell rests of Malleus that are actually proliferating, and this continues to enlarge, and this is what I was referring to as a phase of cyst formation. Now let us see how exactly this particular cyst expands. Now let us move on to the phase of cyst enlargement. This can be explained in this way. As I told previously, there is central lumen and the cells are dying, and then degenerating cells are there and the necrotic tissue is happening. So because of this dying cells and degenerated cells or the degenerated cellular products, the osmotic pressure is higher. So because of this hyperosmolar nature, the fluid from outside will seep into it just to balance the increased osmotic pressure. As more and more fluid seeps into the lumen, the hydrostatic pressure within the lumen also increases, and that leads to cyst enlargement. So because of hyperosmolar nature, more fluids gets in. As more fluids gets in, the hydrostatic pressure increases within the lumen, and this leads to further enlargement of the cyst. At the same time, the cells are proliferating. So all these factors will lead to the enlargement of the cyst, and further destruction or resorption of the bones surrounding this particular cyst. So this is what is the basic mechanism of the radicular cyst formation. This is kind of a cycle, isn't it? So what happens, there is inflammation that sets the inflammatory process, and the inflammatory process sets in a triggering response to the epithelial cell rest of Malleus, and that continues to proliferate, and as the proliferation continues, the central cells will die, and this particular inflammation of the bacterial toxins are continuously there until unless the tooth is removed or you start a root canal treatment. So basically the cycle has to be broken down, then only the enlargement of the radicular cyst stops. This basic cycle can be broken down in three basic ways. One is complete removal of the cyst, which we all call as enucleation, complete removal in total, or the proliferating epithelial lining can be opened up and we can allow the cyst to shrink so that the cycle is broken down, or lastly either the tooth along with the cyst can be removed or we can start a root canal treatment. That is a basic mechanism involved in the formation of a radicular cyst. Now let's move to the most common developmental cyst, the dentigerous cyst. As the name suggests, dentigerous means tooth containing. Denti is a tooth and gerous is containing. So basically it's a tooth containing cyst. Now basically what's happening in dentigerous cyst is nothing but there is fluid accumulation between the newly formed crown of a tooth and the reduced enamel epithelial covering. Now the question comes, why there is a fluid accumulation? There are two schools of thought, or there are two schools to explain why or how exactly this happens. First, the most accepted one is the fluid accumulation between the newly erupted tooth and the reduced enamel epithelium occurs due to the eruptive forces that is inherent within the tooth. As the tooth is newly developed, it is supposed to erupt into the oral cavity, isn't it? As the tooth is trying to erupt into the oral cavity, assume that there is some kind of obstruction to that particular erupting tooth. Now because of this obstruction, the vessels which are there in that particular area are also obstructed, and that leads to disturbance or occlusion of the venous outflow, and because of this disturbance of the venous outflow, there is transudation of fluid getting into it, and that results in accumulation of fluid between the newly formed tooth and the reduced enamel epithelium. That is one school of thought, in fact that is more accepted. Now let me explain the second school of thought, which says that there is fluid accumulation because of degeneration of the stellate reticulum that occurs between your inner enamel epithelium and the outer enamel epithelium, and degeneration of the stellate reticulum leads to formation of a cyst, and further transudation of the fluid also occurs, leading to enlargement of the cyst. Whatever may be the mechanism, either it is through the degeneration of the stellate reticulum or due to the obstruction of the venous outflow, the ultimate end result is accumulation of the fluid within that particular tissue, and because of that there is cyst enlargement, and the cells do have their inherent capacity to proliferate as more and more fluid is accumulating, because there is a pressure that is created by more and more fluid that is being accumulated, and that pressure indirectly acts as a stimulus for the cells that is actually your outer enamel epithelium or the reduced enamel epithelium in that particular tissue. This is the basic mechanism involved in the formation of a dentigerous cyst. Now let us move on to the mechanism involved in the odontogenic keratocyst. Now we all know that odontogenic keratocyst is clinically more relevant, more important, because it has got a higher recurrence potential. However, the mechanism involved in the cyst formation, again there are two schools of thought. The most accepted one theory says that odontogenic keratocyst arises from epithelial cell remnants, but here the epithelial cell remnants are cell rests of serrates. They are indirectly they are cell rests of or cell remnants of dental lamina, and all these cell rests of serrates are usually located within the gingiva of every person. Some researchers also say that the oral epithelial basal cells are also responsible in the formation of odontogenic keratocyst. However, this has not received much of a support. The second main school of thought that arises, that results in the formation of odontogenic keratocyst is somewhat related to your dentigerous cyst. This school of thought believes that odontogenic keratocyst arises from reduced enamel epithelium, and these are called as follicular odontogenic keratocyst. I can simplify in this particular way. Odontogenic keratocyst can be of two types. One, those OKCs which have an impacted tooth within that, those OKCs which does not have an impacted tooth within that. Those which have an impacted tooth are called as follicular OKCs. Like dentigerous cyst, even they have attachment at the CEJ level. It is important to differentiate between these two, because the ones with impacted tooth have a lower recurrence rate than when compared to the ones without an impacted tooth. There is difference in the way they are originated from as well. The ones which does not contain impacted tooth do arise from cell rests of serrates, that is your cell rests of dental lamina, whereas the ones which contains an impacted tooth do arise from reduced enamel epithelium, just like your dentigerous cyst. However, histologically, if I compare the odontogenic keratocyst that contains an impacted tooth, these are also attached to at the CAG level, as I told previously. However, histologically, the epithelial lining exactly resembles like a regular odontogenic keratocyst, except at the area of attachment at the CAG, it kind of resembles a reduced enamel epithelium. Whereas the ones which does not contain an impacted tooth typically shows odontogenic keratocystic lining. This is what is the basic mechanism involved in the odontogenic keratocyst. There is proliferation of the epithelial cell rests of serrates. I hope this video has given you a concept on mechanisms involved in the formation of the three most important odontogenic cysts. If you have liked this video, please show your appreciation by liking the video, sharing with your friends, and if you have any clarifications or any doubts, please leave the comments below in the comment section and I will be happy to address. And as usual, I'll see you all in my next video. Thank you.